So we are live. And
Perfect.
hi, Chi. Yes.
Oh, correct. Hi, hi, Cynthia. Uh,
um,
Thank you for having me here for this chat, and absolutely looking forward to it. My name is Modi, trainee for critical care science. For the record, I'm just going to say this here as well. Amazing. How
sorry.
are you?
Yeah, I'm doing all right. Sorry, can you say that again? What year are you?
So I am in my final year of training. So I'm basically transition from year two to year three trainee now.
Okay.
So not very long to go. So very much looking forward to it to finish.
Yeah, you are getting there. You are you are almost there. What trust are
Yes.
you training at?
So at the moment, I'm based in Royal Papua Hospital in Cambridge.
Oh, okay,
Yeah.
okay. I've been to Cambridge, but it's
Yeah.
with Addenbrooke. I had one of my rotation with them. My bioinformatics was with them.
Oh,
It was more online, but we had
yeah.
2 days physical. So yeah, I was in Cambridge for for two
Oh,
days.
fantastic. Did you do a bit of ponting as well, like when you were in Cambridge?
And no,
Like,
it was really quick. I just came in, had what I
yeah.
wanted to do, and I just left. So I think
Oh,
I
fair enough. Fair enough. Well, now you know someone, so you can always come back to Cambridge and come and see us.
Yeah, of course. I'm definitely coming back in now I'm in second year. So I'll most likely come back second year, and I'll spend a lot of time in third year as well.
Yeah.
Because but this is not about me. But anyway, we
No, 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 it's
um
all right. We can chat about it.
our
Yeah.
lab is part of the Cambridge Genomics lab. So we are
Yeah.
just like an extension of that. So some of the specialist training and all that will be held in Cambridge. So I'm going to spend a lot of time there in 30. Well, whenever I get to Cambridge, I'll definitely give you a
Oh
call.
yeah, feel free to reach out through LinkedIn or anything like that, send us a test and I'll be happy to, I'm more than happy to show you around, especially when the weather is so nice as well. I think that, like doing STP, also taking a bit of a break as well in that
Yeah,
way, isn't it?
yeah,
Looking
yeah.
around the city, do a bit of a boat trip. Well, not a boat trip, but like it's like a tour, pontoon tour that
Yeah.
one of the very classic things to do in Cambridge. But yeah.
Yeah. That's all right. Yeah, I will definitely give you a call. So getting back to it, now you said you're in your third day. So what sort of things are you up to right now on the STP?
Sorry, I missed out some of the questions. The
Yeah,
internet's not that great.
okay.
Apologies. Yes.
Yeah, so you said you're in your third year now. So
Yes.
what sort of things are you doing right now? Your projects? Are you still doing rotations, and what sort of things are you doing right now?
Well, that's a great question. So I think in terms of like coming from year two to year three, you start juggling a lot more things with STP. So STP under the bracket do a lot of research. That's one of the aspects. Another aspect is also the training portfolio as well, which is one thing that we can never forget. So
Yeah.
we always think about it when we're sleeping, when we're eating, or when we're like going out doing something else, still thinking about it in the back of the mind, of course, but not actively thinking about it. So maybe like focusing on the training portfolio is one of the things that I've been doing it because every year, I think ever since that they have changed for the training progressions, that they start with the year one, and then they have got like specific targets to meet, and then year two specific targets to meet, and then year three specific targets in that way. Rather than like it used to be the case of like they have maybe one progression review and then like midway through of like year two and year three, and that was it really. That was used to be the case before, but now they have changed it into like specific years of progression, I think, which is better, I think, because like you've got specific targets to meet
Yeah.
each year in that way. So at the moment, I'm quite focusing on that aspect. So that's one of the elements that I've been doing. Another things I've been doing is like trying to uh, be a bit more practical on the research project as well at the same time. So at the moment, I'm trying to do a project, educational project, based on artificial intelligence in the point of care echocardiography. So whether that AI that we have it in the trust can be used for the educational purposes, or will it be useful for the junior doctors, and also the other allied professionals that who wants to perform the echo scans for heart and lungs and things like that as well. So those are the things that I'm trying to look work as a part of my research project. So it's quite chunk of my time as well, just pulling into the third year.
Yeah.
And alongside all of those things, you also got other social commitments as well, which is that you have to plan your annual leave and trying to time out in that way as well. It's a lot of juggling, but at the same time, I've got like really strong training networks who are pretty much supported, and we are pretty much like share our feelings and experiences when we basically hit a stop point and things like that. So I think that having that sort of community is very helpful as well.
Yeah.
Sorry, if I'm deviating it from the topic that when you are,
It's
but
okay.
yeah, so going into like year 2 to year 3, those are the general focus that I've been doing.
Yeah.
But also there are like clinical task things that we've been doing as well in critical cares, which we can talk about it a bit more as
Okay, yeah.
well. If
So
you like.
talking
Yes.
about talking about critical care now. So
Yeah.
can you take us through what your specialty critical care is about and what you guys do, the types of tests that you run and all that?
Yes, of course. So basically, critical care science is so vast. In the critical care world, we have a different set specialties for the critical care. So there's some critical care unit who actually specialize in, let's just say, liver. So they look after like liver specialist hospitals like Royal Free. So they basically specialize in that sort of area. And there's also some hospitals. And specialize in specific things like neuro, which is in Edinburgh. So they specialize in specific neuro and trauma intensive care units. So depending on the clinical duties, based on where you're training, the clinical duties varies. But I could talk about specifically what is tied down to Papua, which is related to my training and that sort of things as well. So in terms of day-to-day basics, we have a majority of time that where we do a lot of like vascular access procedures, which is essentially means that from the small cannula that you need it from coming into hospitals, and we do also of like central line access, which is like popping the line in the neck, which is giving them medications to deliver quickly in that sort of way. So those are the things that we perform as a part of the vascular access procedures. So we use like lots of medical devices in the vascular service we provide in Papua. So those are the probably the one of the main elements that we do as a part of the critical care scientist team, and also as a trainee as well. The other aspects that we do is a lot of diagnostic testing for the echo. So basically, point of care echo for heart and lungs. Those are the two things that we routinely perform in the trust. We also train the resident doctors when we have more chance of opportunities to with the time in as well in the clinical workloads and all of those things. Also at the same times, we also perform like diagnostic point of care echoes in the critical cares in the critical situations like cardiac arrest and things like that. Someone is looking after the airway, someone is looking after the drugs, someone is doing a chest compressions, and there is also a critical care scientist who is also trying to perform a scan at the same time, trying to identify the pathology and reporting back to surgeons and the consultant intensivists as well at the same time. So we are involved in that sort of elements as
Sounds
well.
like a lot of people working together.
Yes, yes, it does. Yeah. So it's a very, very big team in a way that where we integrate it into as in our own aspects as well in a bigger picture for the patient cares and pathways. And yeah, so these are the ones that we do, and as well as like we do a lot of like research and audits. So those are the ones that we also do as well alongside with it, and also medical education and teaching. That will probably be another chunk that time that we actually invest in the trust as well. So as a trainee in the third year coming into it, I have a privilege of teaching some of the students from the University of Cambridge as a medical students when they come in for the point of care echocardiography as their practical workshops and things like that as well. So we do have that sort of opportunity to get involved in a way that to share our experiences and clinical knowledge in that way as well for the future generation of doctors. So which is very important as a part of STP, because you are not only learning how to do things, you're also reflecting on how you have learned and how to share it to the other people as well at the same time. Yeah, so those are like generic as a critical care science in specifically tied out to Papua of what we do in the
Oh,
trust.
that sounds like a lot because it's patient facing and
Yeah,
it's yeah, my role is also we also work with people from other team, is also
yeah.
multidisciplinary. But you mentioned like the cardiac scientists, surgeons, doctors and students as well. So it seems like you guys are faced with both patients and people and students from different teams.
Yes, that is correct. Yes.
Wow. Okay,
Um,
so
yeah.
that means you have a lot to write about in your reflections and all of those STP stuff.
Yes, we do. Yes. In
But
that
then,
way.
but then one particular question that I was thinking about while you were talking is, um, since it's usually hospital specific, like you said what you do in Royal Papworth is
Yes.
maybe different from what they do in Addenbrooke and all that. So if your training is based in a particular hospital and maybe you get a job or you have to work in a different trust, is it very easy to transition to into the role as a critical care scientist to work in another trust where what they do is different from what you do in your trust? Is it very easy to transition if you have to work in another hospital?
So that is a very good question. So in a critical care science, because since we are like so diverse of what we specialize in and what we do, there is a specific baseline that we could transfer our skill set in that way. So in let's say in raw pathways, we also have a chunk of time that where we spend some time with the clinical engineering to know much about the clinical engineering aspects and how the devices actually come into critical care and how do we use it as a patient care pathway. So it's like translation of what the numbers of the machines were saying, how does it helpful for the patient care? So how do we support the patient care in that way as well? So that is like one of the, I think I can speak for the other trainee as well. That I think that is like the one of the core elements that we integrated into in the other trusts as well. So there is like a certain capacity of similarities, but on the top of similarity, there's other things like vascular access. If you were to go into the other trust and if you were to get a job there, and I think that that might be kind of like a bit tricky because it's like specifically tied down to the trust in terms of the training. And there is also another reason that I chose Papua as well, because I want to specialize in more of an echo and more of a vascular access point and a specialist center in that sort of way as well, which is why that I decided to go down to Papua. Before that, I was working in London about three years in intensive care as well. So I decided to choose in that sort of route to get most out of it in that as a part of my training. But in terms of like the basic training of critical care science of what you have to learn, and I think that everybody got the baseline, but on the top of what you want to get out of mostly is I think it's entirely up to the trainees and where they choose to go and all of those things as well. That's also quite similar to a lot of the doctors are being trained in intensive care as well, because some of the doctors are there the intensivists, but on the top of that, they might be qualified to do a BSc level 2 echocardiography because they're training on the top of that, like something like a dual train that way.
Yeah.
Yeah.
Oh, that
Wait,
that that
answer
makes
the questions. Yes.
yeah, that makes sense now. So at the
Yeah.
end of the day, you all have the basic training, but you kind of specialize and focus on a particular area.
Yes.
Then how does that fit into the STP curriculum, considering that I'm sure that all critical care STPs will have the same and training activities to conclude
Yes.
on one file.
Yes.
So
Yeah.
if you all have like if different trusts have
Yeah.
different approach and focus to critical care, how does it then fit in to the training activities for the STPs?
So that's an interesting bit because in the curriculum there is like a basic things of like let's just say there is like a one training activities like you are required to interpret the X-rays, MRI, and the echo images. So that's like one of those things in one of the training activities. And what you choose to do is you basically try to pick out okay MRI and X-rays, all of those images to interpretations absolutely fine. And then on the echo bit, like you basically got the basic knowledge of like, okay, this is the echo, these are the view, these are the images, and I know how to interpret them. But on the top of it, whatever that you want to do, and I think that is all down to you, your training officer and you. In that way, my training officer in my trust is absolutely supportive about for the things that's sensible for me to do as a part of the critical care science, and for that reason, I've been privileged to be pushed to like a little bit beyond than what I come in after STP when I got a bit more time as well. Because if you already got the business knowledge and if you already on the track of like, let's just say I'm very keen to do an echo and I love learning it and I love teaching other people as well at the same times, and I want to be more focused on echo in critical care. If that is a thing that if I want to do, there is a specific courses that I could do while I'm doing the training as well, because that's what the training budgets are for you to use. That is how pretty much I dive into it. Because in the past I had a couple of colleagues as well who are interested in echo from London, and they're the critical care science trainee, and they came to us and they learned a specific course, specific pathways, and they took their skills back to India Trust and to apply that as well at the same time. So it's all really tied down to like there is a vast majority of like knowledge that you are being given, or like you're being trained to do, but on the top of there is like a certain niche elements that you could do, like a research project. So it's like your niche element that you like, and then on the top of that you build on it. If
Yeah.
that makes sense. Yeah, that is pretty much all we do in critical care
Yeah,
science, I
yeah,
think. Yeah.
yeah. That's very interesting. So then, as a trainee, let's talk about a day in your life or a week
Yes.
in your life. So typically, as a trainee, what sort of things do you get to on a daily or on a weekly basis?
Yes, absolutely. So on the, I think I'll probably start from the daily basics. So on the day-to-day basis, we in Papua in specifically because different ITUs got different schedule for nursing shift and medical staff starting, like starting shift and all those things are very different. So specifically down to Papua, we comes in like about 8 o'clock in the morning. And once we comes in 8 o'clock, we have like a small huddle like between the teams, and we trying to find out what the job load of the day is going to be and things like that. As soon as we found out what we need to be, we've been allocated as a trainee. We've been allocated to different areas or intensive care unit to follow the consultant ward round. So when we go into the wardrobe, we try to find out what are the potential jobs that we need to be, as in, if there is anything like monitors are set up incorrectly and things like that, do we need to change it? And also, like, if there is anything that monitoring devices set up incorrectly, can we do something about it in that way as well? So those are like one of those elements that we comes in. Or if the patient needs to go to the CT but needs a cannula to go to the CT to put a contrast in, can we do that? That sort of thing, like shall we pop the cannula in that sort of like job aspects? So we try to find out while we're going the wardrobe as well. That's also enhance our learning opportunities of the medical management aspects and how the MDT integrated towards that as well at the same time. So you've got physiotherapists, you've got dietitians, you've got speech and language therapists, and everybody just comes in, like from their point of view, and then contribute in that ward round as well. And they come in and pop in and out in that way. So that is like one of the elements that we kind of involved in during the ward round. So it's from like 9 o'clock to, let's just say, about 11 o'clock in the morning. So after they make the plan, we all follow the plan. Okay, this is going to be the medical team plan. How do we get involved in that? Do we need to get like, is there any more like diagnostic imaging, like the patients like really struggle to breathe, like he is on low oxygens? Can we do the low ultrasound to find out what exactly that we need to find pathology in that way as well? Because when you look on chest x-rays, everything just quite grey. We're not quite sure what's going on down at the base and things like that. So specific question to be answered with a diagnostic point of care ultrasound. So those are the ones that we involve in that as well, as a part of the ward round as well as a post ward round. And then there is also another element that we get involved during the day is the sometimes that we got pulled away to do like urgent vascular access for the outpatients or the day ward services. So we quite often go and see the patients in the day ward, outpatients, and as well as inpatients as well at the same time. As the nature of critical care, we got pulled away to where we need the most in that way, but primarily we basically try to go on a ward round, try to find out what we need to do in intensive care, but also at the same time, if there is something like we need to do it urgently in the ward, such as like needing a vascular access for the certain procedure that they're going. Let's just say the patient is going for the pacemaker placement, and they just needed the intraventricular. They just needed the vascular access to give the medications while they're performing the procedure. So we kind of involved in that sort of aspects as well. So we were like a very beginning to get involved, and then the patient goes to the cath labs and then have the procedure and come back to the ward in patients and that sort of things as well. So in a day-to-day basics, so generally what happened is like ward round, we got more jobs coming out from the ward round, as in, like more tasks what to do as a team or as a trainee as well. And then once we finish it, and in the evening, I try to book some time off for the teaching as well. So I've got some medical doctors that who wants to learn a bit more about the point of care ultrasounds with heart and lungs, but they are not quite confident to perform in those things because of their very early of their trainings and things like that. I'm also help them in that way as well. So that's also another element, about a couple of hours in the day. And also like I'll try to catch up with paperwork and also the training activities in the evening as well, which is like roughly about 4 o'clock, 5 o'clock, and then we finish about 6. So, and the documentations and everything like that as well. So this is like the day-to-day basics. And for weekly basics, we, as a trainee, we only do 3 days a week because of the full-time rota of one study day. So it's like a 3 days and a one study day during the week. So 3 days are pretty much like that. And on a study day, I often go to like library in Cambridge, or I often go to like it's one of the study booths in the hospitals and things like that, and then try to get most out of like training activities, and as well as like try to run the STP Perspective blog as well. So that's also
Yeah.
one of the elements that I'm trying to get on. So to try to recruit more writers, and as well as editing posts and all those things as well. And yeah, so that is pretty much like my whole week being. But on the rest of the time, I try to enjoy the other things like cyclings and things like that. Your social life as well. Guilty by like cyclists in that way. But yeah, so yeah, so there's like the weekly basics of what his week look like.
Yeah, that sounds like a lot. But I was wondering,
Yeah.
since trainees are considered as supernumerary for
Yes.
for a role like yours, where which is patient facing as
Yeah.
well as facing people from other specialties, are you allowed to maybe do go on a ward round alone as a trainee? Or like maybe when you started the STP, did you like go around with people, observing them? At what point were you allowed to go out on all these tasks alone as a trainee?
So that is a very interesting question. It's because as a trainee, because for the 3 years you're supposed to be supernumerary until that you're qualifying that way. So my what happened in this trust, in my particular trust in terms of the training, this is also another reason I chose as well, was the during the first year, and I was shadowing around and looking around things for like about at least for like 8 months, which is try to get used to about the nature of the critical care and how fragile the patient is as well, especially with the tertiary hospital. We've got referral from the whole country, like very, very sick patients on the ECMO. So it's quite it's like kind of like intimidating as well once you go into the bed space and stuff like that. So what they try to do is like as a training officer and also my managers as well, what they try to do is they try to facilitate me through shadowing for the different professions and different specialties in a way. So in the first year, like I did a lot of shadowing of the patient pathways coming from like, let's just say out of hospital cardiac arrest, patient coming to a cath lab, they did an intervention, put a stent in, and then the patient's a bit unwell and the ventricular functions are not that great, so they just come into intensive care after with their life support device. So one things like that happens, and like you started to see is like where the patient pathway coming into it, and when you start seeing from like medical team aspects and nursing aspects, and as well as the allied health professional aspects, you start seeing a lot of things in your first year. And I think that actually boosted my confidence in generally to be able to start doing some of the particular logbook that we have to do. So it's like signing off the competency. Also at the same time, the trust has got a specific number of logbook that you have to do. So it's like specific tasks that you do. They basically say, okay, you're gonna practice it on the mannequin first, and then once you practice on the mannequin first, you've done it for like so many times, and then after you say, okay, so I think that you have got ability to do this task. on the patients, and then you go and do the patients. You also explain to the patients that you're very new if you're doing it on the awake patients in that way. And so those are the things that you do. And then from there, you just learn from it, as in, like as you go along. But there will be someone who is supervising you at the time for specific task. So this is like a general that I was just talking about. And then afterward, once you are fully competent to do it, they'll be like, okay, now you can go and do this on your own. And then you take accountable from that as well at the same time. But to do that is because you've got specific qualifications that we do as accreditation from the intensive care societies. So it's like if I were to go and do an echo on a patient who is also not very well, and I've done my logbook and I've done my accreditation, so I'm allowed to report independently on my own if I were to see some sort of pathology behind. But again, because of the nature of intensive care, it's always good to get involved with the consultants all the time or the qualified personnel. So we always discuss the results if there is a significantly worrying in that way. But if it is not significantly worrying, or something that not acutely related in that way, we just say, okay, this is the results of the scan. So this is like where you draw the limits as well, because in the intensive care area there is like so many people, and they could see in a different ways from their specialty where they're trained in that way as well. So there's like a doctors coming from the A&E backgrounds, or there's a doctors coming from the purely from the anesthesia backgrounds, working in theaters, and then coming into intensive care as a rotational trainee. But also, they have got like a one step away before they became consultant level. So those are the people there who is always nice to get involved in a way that to get the share opinion, so the share decisions being making in that way. So this
Okay.
is like the model of intensive care. But in terms of the task that when you're saying supernumerary, it's not entirely supernumerary because you are allowed to do things once you're being signed off, but also at the same times, is one thing that to need to bear that in mind is like you're still a trainee. There is limitations behind it. So if there is significantly worrying or anything that, I think I learned that in a year one, it's significantly worrying that I'll get other people to get involved, because it's good to get other people to get involved than not to and make it a mistake in that
Yeah.
way.
And
So
considering you guys are in critical care, any form
yes.
of mistake I can imagine would be very disastrous.
Yes, yeah. And
Okay.
yeah, so in terms of like the workloads and how the people got involved, we have got like very, very big teams to get involved in that way. So even in medical team, there was like so many different medical specialties just coming at the same time. So it is a huge involvement for one patient for one particular care pathway in that way. And once you're coming into it, and I think that is also, I think it will be only beneficial for the patients if we think our limitations are here, and then report it back to the shared decision making in that way.
Yeah. Well, that sounds interesting.
Thank
Then
you.
let's talk about the university aspect of your
Yes,
STP.
of
So
course, yeah.
for you guys in critical care, what university do you guys attend?
So we go to Manchester Metropolitan University.
Oh, okay. Okay.
Yes.
We in cancer genomics, we go to University of Manchester, but in
Yeah.
first year we had about two of our modules with
Yes.
Manchester Met. So,
Yeah.
yeah. Okay.
Yeah. No.
Then I forgot to ask you about your pre-STP experience, because before I
Yeah.
get into you talking about your STP applications and all that, can you tell us about your experience before the STP as well as your academic background?
Oh yeah, of course, yes, absolutely. So before applying SCP, I was doing my undergrad in medical physiology. So that was 3 years, and then once I finish, I think in the third year of my degree, that is when the COVID hits, and I think everything was online at the time, so it was quite tough to function properly. And then just finishing off my third year, that was the time that when they start lifting out the restrictions. So I probably had like maybe the like intense bit of like practical sessions at the university for like
Yeah.
like in 3 weeks time. So that was one thing that's significant I remember from it. But for my degree, because I had a bit of a both sides, is in medical physiology that you have laboratory side of it, which is a life science aspect, so where you do a lot of biochemistry, pathology, and as well as the pharmacology aspects. So those are the ones that are being involved. And also there is also other aspects where you do like ECGs and as well as like trying to monitor the patients or the exercise testings and all of those things as well, which is very useful for pre-op assessments and things like that. So those are the another elements that are being involved, which is also quite similar to the physiological sciences as well at the same time.
Yeah.
So I didn't know where I'm gonna pull away. So that was a bit of a dilemma that coming out of university degree, but I had COVID's got a lot of bad things, but I also had a bit of a privilege of like working in intensive care at the time because when they were having a staff shortage on the nursing aspects, and I started working as a healthcare assistant slash associate practitioner's roles that they newly brought out at that time in the particular trust. And so I've started working in general ICU about 3 years, so where I start learning a lot more about the nature of intensive care. It's like a good entry point in the general hospitals where they got maybe ventilators and the hemofiltration machines where they take out all these ureas and lactates and all of those things, and which would damage to the muscle tissues and with the machines. But yeah, so I had a very general introductions of that for about 3 years, and at the time, beginning of it, I think I applied to STP for the first times and I didn't get in, and the second times not quite, and then third time I've got it in that way. So I'm third time candidate who applied to SCP in 3 years in a row when I was working in intensive care.
Wow.
But yeah, and then I've got into SCP and I eventually moved to Cambridge for my training, and yeah, so it's near
Wow.
the end there.
Wow, that's quite a journey through critical care. So for the STP application, I'm still
Yeah,
going to ask you about the things you changed in your application, but let's take it one step at a time. So
yeah,
starting with the STP application, can you
yeah.
tell us about your application experience, your STP application experience?
Absolutely. So I think the first time when I applied to it, I still got the
Situational
test.
test?
So not situational judgment test. The other one actually, like the one with the dexterities and all of those text things, is it's not like GAMSAT, but it's like a mini GAMSAT or UCAT and that sort of thing. It's like very
Oh,
very tiny, not as in nothing near to that sort of thing. But I don't think it's unfair to even use the name, but it's like the best way that I could describe it in that way. So there's like a two elements for that. So one of them is that, and then one of them is the STT. So there was two elements that when I applied it like a while back, that was just we're talking about like 5 6 years ago now, in that way. Yeah, 5 years ago I think. Yeah. So and I think that I was the last batch even ever to go through that when I applied to that, and but at the time when I applied to it, I applied to cardiac science, and I had an interview from the Newcastle Trust at the time. But the reason that I couldn't go through at the end of it is like I was not quite sure that cardiac purely is something that I would be uh, able to do, like as in one of those invasive procedures in the cath labs being there, and I was not too sure about the rules either. So I think when I did the interview and I was not investigating enough, that was also another thing as well. So I think that was just very much of a reflected on it. So I think that I failed on the interview. Also, at the same time, the interviewers were pretty much like very honest and asking the questions like, like this is going to be the 3 years program. Over that, this is going to be your career. Is that something that you want to do? And coming out of uni and stuff like that, and showing some bit of hesitations in the questions as well. I think that that does not reflect very well.
yeah.
So knowing the role is probably the good things that for a fellow trainee to do, or
Yeah.
any sort of STP candidates. So that was the first time. And the second time was because of the out of hospital cardio arrest patients I was looking after at the time. I was quite interested in neuro as well. So I got in touch with the neuro department in my trust, and they say, if I were to interested in with neuro, they might have a direct entry for the pathway. So the second time when I applied to it, I applied everything through. in a sense that I basically get application ready and all those things, but the funding and the trust didn't work out for to get the direct entry applicants. And at the times, and I started to step back saying, I mean, I've been deviating from critical care, and I work in critical care for about 3 years
Wow.
now. And I think that I should probably search a bit more about critical care science. That's also the first time that I found out about critical care science. And I investigated into it and I applied it for the third time and then got into it. But yeah,
Wow.
it was a bit of a long detour, but and I think that eventually I got there.
Yeah, that's what matters most.
Yeah.
Eventually, eventually you got there. So for your critical care interview, what was your experience on that?
Yeah.
Were the questions was the questions very basic, or were they very should I say specialized, or what was your
Yeah.
experience generally on the critical
Yeah.
care interview?
No, absolutely. So in terms of interview questions it's like other physiological sciences or life sciences. Well, there's a two parts: a specialty and the scientific questions, and the other one is the professional practices in terms of that sort of baseline that they're trying to get you from. So my interview panel was very encouraging in terms of like asking, like asking the questions. If I have given the short answer, they kind of like promote in that way. So they were just like, okay, you've given this answer. Is there anything that you want to add? Or is there anything that you want to elaborate on this? So when they basically prompt in that sort of aspect, so I think that I say more things, as in, like collect more evidence and with the STAR techniques and all those things. So which is very, very helpful. And I think that one of the aspects that I find it a little bit challenging in critical care science in the interview, particular for me, but I don't think other trainee has it, was or they had it in some capacity. So they asked the professional practices questions, and two of those questions, and then one specialty questions, like one specialty questions come into it. So it's like two questions, and then now we're gonna move back to this. Now I'm gonna move back to that, that sort of thing. So it's like one of those things that it's like it's not as in like that we're gonna finish with professional practices first, and then we're gonna go into specialty. It's not like that in that way. And I think that in the interview as well, because of the prior experience in critical care, and I think that they cannot ask me the questions not as an interview in that way, but it's more of like having a more of a chat. So there is a specialty questions about the specific questions that they ask. I think that is like the requirements by the national school. But also there's other questions that they were just like, okay, you answer this, but out of curiosity, but what do you think that could have happened for this particular patients and particular pathways? And it was very nice to have a chat in that way because it feels like I've learned quite a bit from the general hospital as a starting point, and then how is that translating to the tertiary specialist hospitals in that way as well. So it's almost like this is like the candidate that they has got some sort of like experience in the background. How do we build on him in that sort of impression that I'm trying to give them as well at the same time? So it's like it's not that like I just know it all. It's like I know this, I know that, but there is at one point I couldn't answer the questions. I was just like, I'll be happy to hear your thoughts, and
Yeah.
please do explain this to me. So even in the interview as well, they do explain about okay, like this is what we do in a tertiary hospital in that particular pathways, but you will learn it more when you're doing an STP. And I was just so this is more encouraging in that way as well.
Yeah.
Interview questions approach like that. That is one thing I would say. I really enjoyed it. That would be one thing I would say. Yeah.
Yeah, that's cool. Then, for the persons that are hoping to apply to your specialty, last year they asked them to talk about the role of a clinical scientist within their specialty. I know you've
Yes.
talked about your specialty before,
Yes.
but if you're asked like, what's the role of a clinical scientist in critical care, like, what would the summary of that be?
Um, I think I would probably say that we are the safety measures of the critical care. So not only that we do research on the units of the medical devices in generally, we also constantly trying to trying to find the ways of like how to improve the patient case by using our latest technology in the market, and also at the same time how to save trust some money
Yeah.
at the same time as well. So like how do we
Everyone is saving money for the NHS, even in
yes.
my department, we're all saving money.
Yes. So yeah, so that I think that will be the maybe about 30-40% of the clinical scientist role in that way, because you're constantly looking out for new technology, how to make the patient pathways easier and better as the hospitals, and to reduce like infection rates, or to reduce like mortality or morbidity behind it, like after the patient going to like from like post hospital in that way, so all of those things as well. So those are the ones that we constantly looking for, and as well as saving money. That's also another thing is as well. We want to use the latest technology, but very very less money, if we can. So that was so it's like absolutely efficient, safest patient pathways with less money. That would be the ideal thing to do. So I think as a clinical scientist in critical care, we always look out for those things, as well as like we are very pro for the medical educations and research, and that's always as well. So medical education, nursing educations, we train a lot of stuff because we are based in critical care, and also we've been around to the different ITU for from the certain period of time doing STP. We know how the nature works and what is involved in that way as well. So as a clinical scientist, you still do about 70% of clinical workloads of what you need to do, diagnostic testing, setting up the machines, equipment, when it need to be involving in patient transfers, intra-hospital patient transfers from the MRI, CT, all of those things as well. So you are pretty much of the safety reassurance, all the devices that patients are being supported, and you're going with them in that way. So you're
Yeah.
like, is something wrong? What are we going to do? What is the backup plan? Is there any clinical scientists around it for that? For in critical care. So we're like a backbone for it as well at the same time. So is I'm really sorry if I'm not giving you a straightforward answer, but
It's
I think
okay.
there's more elements of things that are being involved. But yeah, so that would be my definition of the clinical scientist in critical care, I think.
Okay. Yeah, that's good because, of course, even clinical scientists within cancer genomics as well, there's no strict definition to our role.
Agree.
They're just
Yes.
like you explained, they're like different aspects of it. So for anyone coming in, it's definitely good to have an understanding of the various aspects, just
Yes.
to also know what you are getting into, because it doesn't make sense to get into a specialty that you
No.
don't truly understand what it's about.
No.
So, if you have, I'm going to ask for two advice. One
Yes.
for incoming trainees,
Mhm.
persons that are starting STP afresh. What advice do you have for them?
So, one thing that I would probably give advice that's also come from my training officer as well, which is very, very useful advice. So, when you go to the uni, I think if you were to do like most of your workloads when you are in uni, I think you're gonna have a better times when you come back to your training place. So, I think that if you can get a chance to finish most of your uni workload while you're going away for that chunk period of time, and I think that you probably gonna have a better chance of like doing other stuff when you come back to the unit, and just specifically tied out to critical care. One is just because of the nature of like people are busy, people will ask you to do things, and it just keep on going on and on and on until the exam time period. It's just like I haven't done any of my revisions or like assignments and all those things. That's one thing that I would say for the current trainees. Also coming into the potential trainees, and I think that observership in different trusts and different places, and trying to, if there is like a certain post that come on the certain places, and I think that being proactive and speak to the potential training officer or the managers, you can you can message them through LinkedIn, or like on the specific training networks and things like that as well. You could reach out to them saying like, I'm a potential candidate for this. I applied to this, but I wanted to learn more about the role. And can I come in for a day and do this? And the worst they can say no. So
Yeah.
like that is one thing that I'll encourage for anyone there who wants to pursue a career in critical care science. So I think that it's very important to see with your own eyes, and think about that. Is that the workplace that you're gonna fit in, or is that the place that is that the things that is that the place that you want to do the training in the next 3 years, because that's going to be your home, and spending most of your time in that way as well. Do you like the team and all those things as well? Because interview and also the training places is pretty much a mutual pathways, because they have their expectation from you, and also you have your expectation from them as well at the same time. What do you want to get out of STP? So, and I think that making sure what your training place is going to be like, or potential training place where you want to go is going to be like, and I think that those are pretty important to find out before you even start applying to STP in that
Yeah.
way.
Oh,
But
that's a
yeah,
good one. Then I was going to ask you about what is it called? STP perspective, if you
yes,
don't
oh
mind.
yes, yeah,
Yeah, because STP Perspective is one blog I really love because when I was applying to the STP,
yeah,
I was there on that blog and I read every post they have there about the interviews, the advice, and I really picked so much from it. So for since you're one of the editors, right?
practices,
So
yes.
how do you guys get trainees that write or post about their experience on that blog? Do you like reach out to people or they just send you guys their write-ups or yeah. Well,
One of the things that we often do is like we actively post on social medias of like we looking for more writers and things like that. So
okay.
that's also one of the things. And also as a part of the professional practice as well, because some trusts seem to accept of like if you were to publish the specific ideas of what you have written as a piece as a professional reflected, and they will sign you off from the training officer in that way as well. So
Oh,
that's also another reason that we're getting more and more trainees who wants to write for us. Like, okay, like this is my, let's just say this is like the 10 list of things that I've done in my training as a plan, and this is the goals, and these are the achievements I have, and I'm going to write it as a post, and then I'll publish it in that way as well, which is we are more than welcome to have it in that way because any insightful information and advice is useful. So, and I think that in a way it's also win-win situations, like they basically write to reflect it on their professional practices, and also that could be published on the post as well at the same time. So I think we kind of did it in that way for a few trainees in the last 3 to 4 weeks. So we've got a few more writers still coming up and they want to write more about it as well. And also like we also got the potential trainees through emails and through social medias. And there was a specific trainees who wants to share about the specific experiences, why they chose their own, like specific specialty and that sort of things as well, which is like inspiration story coming from the first year trainees. And I think that first year trainees are probably the most targeted group that we try to reach out to because they're very fresh coming into the professions with the brand new ideas and all those things. And still third years are, but but we a little bit biased because we go down the route a little bit. But first year's got like really fresh ideas, and I think that is in science everything is changing, and I think that what we know today is not going to be the same tomorrow, and we
no.
always have to learn, keep on learning, and keep on topping up in that way as well. And also, it's the same things for all the clinical scientists and across different specialty, and
Yes.
and yeah, so we kind of like promoted that. So ideas like, is there anything that you have learned specifically from your interview, or is there something that you want to do as a part of your training or specialty in that way? So it just it's come from so much of a different ideas, and as well as the third year as well, when they actually going to elect it like overseas. Like some people actually did it overseas in specific areas in the life sciences, and like we published those posts as well, which is absolutely amazing because that just given like a pavement of the pathways that these seem to be these can happen if you were to interested in doing this. So it's
Yeah.
also encouraging the fellow trainees as well in that way.
Yeah.
Yeah, sorry if I'm answering your questions, but it's just
No, no,
we
no, it's fine.
we try to reach out mostly through the social medias across different platforms. So that's probably the main one that we do. And also, I think that you done the induction yesterday, with an
Yeah.
school, and I also got involved with the network after. You guys finished as well, I think. So that's also another time that where I got like maybe about 10, 15 people training. They were just like, oh, this is so cool. How do I get involved? And how do I start writing a piece? Like I've got a very unique story that I want to tell you. This is
Yeah.
inspiring. And I was like, yeah, please do, like the blog is for you. All we do is just to edit out for the things that they could be put it in a different ways and that ways, but rather than not losing any, like any meaning towards to what they wanted to say.
Yeah.
Um, because we're also funded by the national school in some capacity. But yeah.
Yeah. Well, that's really inspiring and thank you guys for doing that because you are doing an amazing work. I can testify that that blog was really helpful to me. So thank you guys for doing an amazing work out there.
It's
And
trainees by the trainees. Well, trainee blogs for the trainees. So yeah,
yeah, thank you so much, Kai. No, not Kai. Thank you so much,
don't
Chi.
worry, don't worry. It's
Thank you
okay.
for
Yeah.
thank you so much for doing this with me. I really appreciate it.
Yeah.
And thank you for all the advice, and I'm grateful.
Well, thank you for having me as well. This is a privilege to share on this channel.
Yeah,
It has been amazing.
yeah,
So yeah, please do let me know if you're in Cambridge around or anything like that. We'll try to have some downtime and do some ponting as well and catch up about our specialties and things like that. It will be great.
yeah,
It will be good to catch up with fellow trainee clinical scientists in a
yeah,
different specialty. Of course,
definitely,
you can share your insight into it as well, so which will be good. But yeah, thank you for having
definitely.
me.
I will do that.